Hi, welcome to the Gold Coast University Hospital Emergency Department, or ED. This is one of the busiest EDs in Australia, providing treatment to around 300 patients each day. As you can see, the ED is a very busy place. We treat patients of all ages, and there's an incredible mix of injuries and illnesses which range from minor to life-threatening. So I'm sure the question on everybody's mind is, why am I waiting? That's a great question. The first step to answering it is to consider how the ED works. On arrival to the ED, every patient undergoes an initial assessment by one of our specially trained nurses. Our nurses determine who needs the most urgent medical care using a process called triage. The triage system is designed to prioritise patients with life-threatening issues, rather than on a first-come, first-served basis. This works in your favour if your problem is complicated and urgent, but it also means that patients who arrive after you may be seen before you. There are many factors which contribute to wait times. Critically ill patients, for example, may require resuscitation, which involves large teams of medical and nursing staff. This diverts doctors and nurses away from other areas, leading to longer wait times for patients with non-life-threatening illnesses and injuries. It's important to remember that critically unwell patients can also arrive via ambulance, helicopter, and from other wards in the hospital. These patients are generally triaged in a separate part of the ED, meaning that the department could be far busier than it looks in the waiting room. The ED is a gateway to a much larger network of people and services that make up the Gold Coast University Hospital. Consider a critically ill patient who requires admission to another specialty ward. We certainly understand that long wait times can be frustrating. We do our best to ensure that you receive meaningful treatment as soon as possible. Patients, relatives and staff all want to be safe in the ED. We have a policy of zero tolerance towards violence. This means acts of violence, swearing, threats or verbal abuse will not be tolerated. Once you receive initial assessment, a nurse will continue to monitor your condition in the waiting room. If you are concerned that your health is deteriorating, please let one of our staff know. At this point, I'm sure you're wondering if there's anything you can do to make your wait shorter. The answer is yes. Make sure to tell the triage nurse of any allergies you have, if you are pregnant or breastfeeding, if you have recently been overseas, and if there are any medications you are taking, as well as why and when you need to take them. You may also be advised not to drink anything because you may need an operation or tests which require you to have an empty stomach. To avoid further delays, please ensure you follow the instructions provided to you. It's important to ensure that we have your personal and contact details correct, as well as your family doctors. This will allow us to pass on test results as required. If you haven't done so already, please make sure the clerk at the triage window has this information. If you decide to leave before being treated, please make sure you discuss this with the triage nurse before you leave. If you have any concerns or questions about your treatment, please ask one of the nurses or clerks at triage. I hope this makes your wait in the ED a little easier. Thank you for your patience.